question of suitability depends on the results of a consultation. The majority of young myopic people are suitable. Maybe 1 in 20 might not be if they have an especially thin cornea or if they have an irregular shaped cornea. And that's picked up on this kind of equipment here, an orb scan machine or a corneal topographer, which shows the shape of the eye. The thickness is measured during the consultation with a little ultrasound probe. But the majority of short-sighted people are in fact suitable. Long sight is a bit more difficult. The turn-down rate is a little higher because the patients are older and they often have associated eye conditions such as cataract or glaucoma. And I tend to turn down maybe 1 person in 5 who comes to me for long-sighted treatment. But in the end, one has to have a detailed consultation with the surgeon to decide whether or not you are suitable for laser eye surgery. The first stage of laser eye surgery involves a detailed consultation, which should take anything between 30 minutes to an hour, preferably with the surgeon who's going to do the procedure. Then there should be a cooling off period for the patient to consider whether he wants to have this treatment and how suitable he feels he is or she feels for it. The treatment itself, I always emphasise to patients, is quite painless, and there's nothing to feel apprehensive about in the laser room. I'll talk you through the treatment, and it takes about 8 to 10 minutes each eye, and increasingly nowadays the majority of patients have the 2 eyes done together. We didn't used to do it like that, but increasingly now, especially in routine cases, both eyes are lasered at the same sitting, so to speak. The treatment itself simply involves having anaesthetic drops put in the eye. There's no needles or anything unpleasant like that. And anaesthetic drops are put in the eyes, plastic tapes are applied to the eyelashes, and a clip is put in the eye to stop blinking. And then the laser is used on the front surface of the eye. Either one is lasering the surface of the eye, which is a LASEC procedure, or one is cutting a little flap or membrane, and it's a LASIK procedure. But in either event, the treatment takes about 8 to 10 minutes per eye. So the patient's in the laser room about 20 minutes in total, and there's certainly no pain from the treatment at that stage. In the half an hour afterwards, as the anaesthetic wears off, the LASEC patients, where one's lasered the surface, the eyes do start to water quite heavily and can become irritable and slightly painful. And their recovery period is a good deal longer because the lining of the eye has to grow back, and that takes anything between 3 days to 7 to 8 days. And the LASEC patients are usually fitted with contact lenses for the first 3 or 4 days to reduce the pain and help the healing. The LASIK patients have a little bit of stinging in the first 2 or 3 hours, but they recover very much more quickly, and the vision recovers very much more quickly, and usually the LASIK patients are up to the driving standard the next day and have no pain whatsoever the next day. And that is the big advantage really of the LASIK procedure, the speed of visual recovery and the lack of pain afterwards. But of course that issue is discussed at the consultation to decide which is the more suitable treatment for an individual patient. Laser eye surgery is actually one of the most successful of all branches of ophthalmic surgery. I would say that on the myopic group, 99% of patients should get out of glasses without any great difficulty or dramas. A small percentage will need a retreatment or fine-tuning, if you like, to get them absolutely spot on the visual charts afterwards, and that is what one is looking for in the post-operative checks, to see if the patient is on target and is completely happy with their vision. If they're not completely happy, 2 to 3% of patients will benefit from a small bit of extra laser, which is usually done after about 3 months. But the overall success rate is really well up in the 98–99% success level, and it's very unusual now for patients to lose lines of corrected vision. And of course the benefits of surgery are that people simply don't need glasses or contact lenses for routine activities. Patients over 40, of course, have to be warned that they'll need reading glasses, although that's usually more like 50 rather than 40. But the young myopic patients particularly are usually completely free of glasses for distance activity, really for the rest of their lives. A lot of patients ask me, does this wear off? And really it doesn't seem to. We occasionally see patients back after 10 years, and we can still show the effect of the laser surgery that they had 10 years ago very clearly on the shape of the eye.